Since Governor Shumlin's State of the State address back in 2014, and long before that for many who are here today, we know the opioid crisis is one of the most significant challenges we face as a society and will face for the foreseeable future. Knowing the scope of the challenge is half the battle, and my administration and I have made it a priority to build upon the strong work of the previous administration in this area. This epidemic touches each and every one of us, and if you don't believe it has, you just haven't searched enough and just aren't aware. It has stolen the lives of those suffering from addiction and any sense of peace from those who love them. My administration's approach to the opioid epidemic is to view it as a four-legged stool. One leg represents prevention and education, another for treatment, a third represents recovery services, and a final leg focused on enforcement. To help establish a more cohesive and streamlined approach, I created an opioid coordination council on my very first day in office. This diverse and talented group, led by Jolinda LeClaire, the Director of Drug Prevention Policy, is made up of community leaders, prevention, treatment, and recovery experts, law enforcement, healthcare professionals, and most importantly, people who they themselves have suffered from the disease of addiction. This group meets every single month and is currently working on policy recommendations in all four areas of our approach, which they will bring to me this fall. Alongside these efforts has been a lot of work and collaboration in the treatment and recovery sector so that Vermonters with immediate needs have access to these crucial services. This summer, we opened a new opioid treatment hub in St. Albans and the inpatient facility through Valley Vista and for GEMS to fill some of the capacity challenges we face. It's not often we get to announce good news in this area, given the immediate and long-term challenges of the opioid crisis and the devastating impacts it has on all of us. However, today, we can say Vermont now can quickly meet the demand for treatment services in all 14 counties. And we appear to be one of the first in the nation able to say that. It's particularly significant that this announcement be made here in Chittenden County, where the wait list for opioid treatment was the longest in the state, mainly due to its large population. After months of incredibly hard work by many, we have collectively eliminated the wait list for services in the Chittenden County Treatment Hub. Mayor Weinberger's leadership and advocacy to tackle this issue has been instrumental. In partnerships between doctors in the University of Vermont Medical Center Network and the Howard Center, serving as the hub, has made this announcement possible. Ensuring timely access to treatment is important because of many factors. First of all, it saves lives. People in treatment are much less likely to die of overdose. It also helps prevent prescription medicine misuse from crossing over to heroin use. People can also start recovery sooner. It makes it easier for individuals to ask for help. It shows we care deeply about our sons and daughters, our parents, sisters and brothers, and our friends and neighbors who struggle with the chronic disease of addiction. And it reflects the full engagement of our medical and addiction treatment community partners in responding to the opioid epidemic. I want to be clear about this. This is not a spike the football in the end zone type of moment. We all realize we have so much more work to do. But this is a positive milestone for the state, and we must take the time to recognize it as such. To any Vermonters who know or who need to know more about what treatment and recovery services are available in your area, the state's health resource specialists, in conjunction with the United Way, are available by dialing 211. They can talk you through the resources that are available to you. Finally, I would like to thank everyone who has played a role to make this milestone possible. That includes those here today: Commissioner Mark Levine, Director Jolinda LeClaire, Secretary Oliver Way, Bob Vick, and all care providers at the Howard Center, Eileen Whalen and the University of Vermont Medical Center physicians, Chief Del Pozo, and Mayor Weinberger. I'd also like to recognize the work of the legislature and Attorney General T.J. Donovan for your ongoing contribution and collaboration in addressing the opioid crisis. And special thanks to the legislators who are here. I see Senator Ginny Lyons, as well as Representatives Brian Gina, and I believe, I don't know if Ann Pugh is here, but we thank her as well. We're all in this together, and together we continue to lead in addressing this public health crisis. At this time, I'd now like to recognize and ask Bob Bick, CEO of the Howard Center, to say a few words.
Welcome. When we opened the Chittenden Clinic in 2002, we had no idea of the pernicious nature of the opioid epidemic that would overtake the state of Vermont. The combination of illicit drug use and the overprescribing of opioid medication resulted in an epidemic that was far and away different from what we had ever experienced in the state of Vermont in terms of drug trends. In the last 15 years, we have always had a waiting list here at the Chittenden Clinic. And in fact, in 2013, we had over 750 names on that waiting list. So it really is with a great deal of satisfaction that we're able to be here today to talk about having no waiting list. Going forward, we will be like any other acute medical facility, able to triage each case on its clinical merits and at the time of presentation. The accomplishments are in no small part due to the incredible work of the clinical, medical, and administrative staff here at the agency, but it really would not have been possible without the active engagement and support of our clinical community partners, specifically the University of Vermont Medical Center's physicians, Community Health Center of Burlington, the City of Burlington, through the mayor and the police department. But it's also important, I think, to mention Northwest Vermont Medical Center, because they stepped up and allowed the hub in Franklin County to open sooner than it might. That's allowed us to transfer just under 100 individuals back home to their community and open up an equal number of slots here in Chittenden County. Additionally, since 2013, we've distributed over 15,000 doses of naloxone to active opiate users, to their families, and to over 100 community groups throughout Northwestern Vermont.